Hi, my name is Muhamamad Amirul, mention number 0300. Today I will be presenting a case study on a chemotherapy treatment for breast cancer. This case involves a 38 years old female patient diagnosed with right breast cancer, and the chemotherapy regimen used in this case is docetaxel. In this presentation, I will explain the definition of breast cancer, risk factor, sign and symptom, diagnosis, treatment options, chemotherapy calculation, mechanism of action, and patient monitoring during chemotherapy. Breast cancer is a disease where normal cells in the breast grow uncontrollably and form a tumor. Normally, cells in the body grow and divide in a controlled manner. However, when genetic mutation occur, these cells begin to grow rapidly and uncontrollably. This abnormal cell can form a tumor that may invade nearby tissue and spread to other parts of the body through the lymphatic system or bloodstream, which is known as metastasis. There are several risk factors that may increase the risk of developing breast cancer. First are non-modifiable risk factors which cannot be changed. These include female gender, increasing age, family history of breast cancer, and genetic mutation such as BRCA1 and BRCA2. Second are modifiable risk factors which are related to lifestyle. These include obesity, alcohol consumption, lack of physical activity, and prolonged hormone replacement therapy. Understanding this risk factor can help in early prevention and screening. The common signs and symptoms of breast cancer include a lump in the breast or underarm area, which is often the earliest signs. Other symptoms include changes in the breast size or shape, skin dimpling, which may look like an orange peel, nipple discharge, nipple inversion, and breast pain or swelling. However, some patients may not show obvious symptoms in the early stages, which is why the regular screening and self-breast examination are important. Breast cancer is diagnosed through several clinical investigations. The first step is usually a clinical breast examination performed by a healthcare professional. Imaging tests such as mammography and ultrasound are commonly used to detect abnormal masses in the breast. In some cases, MRI may also be used for further evaluation. However, the definitive diagnosis is confirmed through a biopsy, where a small tissue sample is taken and examined under a microscope to identify cancer cell. Next is the treatment of breast cancer. Depends on several factors such as stage of the cancer, tumor size, and the patient overall condition. Common treatment options include surgery, chemotherapy, and targeted therapy. Surgery involves removing the tumor or affected breast tissue. Chemotherapy use anti-cancer drugs to destroy rapidly dividing cancer cells. And the last one is targeted therapy. It is used to specifically attack cancer cells with certain receptors while minimizing damage to normal cells. And targeted therapy is considered what we call it, the most expensive one. In these cases, the patient is a 38 years old female who was diagnosed with the right breast cancer. The chemotherapy regimen used for this patient is docetaxel. Docetaxel is a chemotherapy drug that belongs to the taxane group, which is commonly used in breast cancer treatment to slow down or stop the growth of cancer cells. Next, I will explain the calculation of docetaxel for this patient. The prescribed dose is 100 mg. The available strength of docetaxel is 80 mg in 4 ml per vial. First, we calculate the drug concentration. 80 mg divided by 4 ml equal 20 mg per ml. Next, we calculate the volume required to obtain the prescribed dose. Volume required equal 100 mg divided by 20 mg per ml, which equal 5 ml. This means we need 5 ml of docetaxel solution. Since one vial contains only 4 ml, one vial is not sufficient. Therefore, we need 2 vials of docetaxel to obtain the required volume. Finally, the 5 ml of docetaxel is diluted in 250 ml of 0.9% sodium chloride. So the final infusion volume becomes 255 ml. Next, I will explain the mechanism of action. Docetaxel works by affecting the microtubules inside the cancer cell. It binds the tubulin protein and stabilizes the microtubules, preventing them from breaking down normally. This disrupts the mitosis process during cell division, causing the cancer cell to become arrested in the end phase of the cell cycle. As a result, the cancer cell cannot divide and eventually undergo programmed cell death, also known as apoptosis. Pre-medication is given approximately 30 minutes before chemotherapy to reduce side effects. The drug used include granisetron 3 mg injection, which help prevent nausea and vomiting. Pantoprazole 40 mg injection is used to reduce gastric irritation. Metoclopramide 10 mg injection is given as an anti-nausea medication. Lastly, chlorpheniramine 10 mg injection is administered to prevent allergic reaction. Thank you. The chemotherapy administration is performed through intravenous infusion in the daycare chemotherapy unit. First, normal saline 250 ml is infused over 30 minutes. Next, docetaxel 100 mg diluted in 250 ml normal salines infused over 60 minutes. After the chemotherapy infusion, normal saline 100 ml is administered over 15 minutes to flush the line. Throughout the process, the patient is closely monitored for any adverse reaction. Monitoring during chemotherapy is very important to ensure patient safety. This includes checking full blood count to monitor white blood cell, red blood cell, and platelet level. Liver function tests are also monitored to ensure the liver can metabolize the drug properly. Healthcare professionals also monitor sign of infection and any allergic reaction during the infusion. Chemotherapy drug can cause several side effects because they also affect normal rapidly dividing cell. Common side effects include nausea and vomiting, hair loss of alopecia, fatigue, and bone marrow suppression. Bone marrow suppression may lead to increased risk of infection, anemia, and bleeding. Therefore, patients receiving chemotherapy require close monitoring and supportive medication to manage the side effect. Thank you. Therapy drug must be handled with strict safety precaution. They should be prepared in an aseptic environment, usually in a cytotoxic safety cabinet. Depending on the drug, they must be stored either at control room temperature or refrigerated condition. Prepared chemotherapy solution must also be used within the specified stability period to ensure drug safety and effectiveness. In conclusion, breast cancer is one of the most common cancer affecting women worldwide and remain a major health concern. Early detection through screening and proper diagnosis play a very important role in improving treatment, outcomes, and patient survival. In this case study, the patient was treated with a docetaxel chemotherapy, which worked by interfering with the microtubular function of cancer cells and preventing them from dividing. This ultimately leading to the death of cancer cells and help control the progression of the disease. Accurate dose calculation and proper drug preparation are very important in chemotherapy treatment to ensure the correct amount of drug is administered safely to the patient. In addition, pre-medication, careful monitoring, and proper administration technique are essential to reduce the risk of side effects and complications during chemotherapy. Therefore, effective chemotherapy management combined with proper patient monitoring can significantly improve the treatment outcome and quality of life for patients with breast cancer. Thank you.